Mental health issues. It's all around us, everywhere we look. From the person sitting next to you, all the way to the Hollywood Hills. Welcome to another episode of Hollywood Mental Health. Today we will review the movie titled Starving in Suburbia and investigate the mental health of the main character, a 17-year-old girl named Hannah. The movie starts off with Hannah's best friend, showing her a site called Thinspiration. The site has a chat room and Hannah joins it and makes friends with someone who gives her tips and encourages her to lose weight. This online user continues to push her deeper into the platform and the dangerous lifestyle. However, Hannah doesn't learn how to hide her habits, and her parents and 15-year-old brother quickly find out. As a result, Hannah has to delete the profile, and making her delete this profile was an important step. However, later on, Hannah gets back onto the site and starts hiding her disorder from her family again. She meets with another user on the site and who tells her to not be led too far down the path of no return, aka anorexia. However, this does not stop Hannah, and she continues to lose more weight. Because of this and her erratic behavior, she and her best friend have a falling out. Later on, we see that there is tension between her father and her brother. Her brother is a wrestler and is trying to lose weight in order to get into a lower weight class. In the night, we see him in the kitchen after he's gone to bed making a protein shake. The dad comes in and tells him that he can't eat it, but he's already had dinner. Even though he's starving, he understands and doesn't eat it. At the same time, the main character is spiraling out of control and is yelling at everyone and refusing to eat even a bite of salad during family dinner. Her mother finds tons of food of her daughter's left in the closet instead of eating it. The food is so old it is rotting and full of bugs. Because of this, she is forced to start going to a therapist, but of course, her insurance doesn't pay for inpatient treatment. She ends up with a lackluster therapist who has lost lots of children to eating disorders. But even that is too expensive for the family, and they end up settling on the only thing they can afford: a few outpatient meetings a month. This lack of support understandably doesn't get through to the main character. As we all know, you have to want recovery to recover. The other good Thinspiration user from the beginning who has contacted her reconnects a few times and tries to remind her that the first user who got her involved in Thinspiration is a bad person and shouldn't be trusted. However, Hannah continues to lose weight. Later on, her brother makes his weight class in wrestling and the whole family is at the first wrestling match. However, he ends up collapsing and goes to the hospital. While there, we find out that he was the nice user messaging his sister on the platform. He knew it was her and he was dealing with his own eating disorder. His father says, "That's impossible. He's a boy and an athlete. He can't be anorexic." However, the brother sadly dies in the hospital. Following this, the main character recovers. This movie sheds light on the things that nobody really talks about. This includes boys getting getting eating disorders, therapy not always working, and insurance not covering much. Overall, this was a great movie, and I highly recommend you all watch. Now that we have all the background info, let's dive deeper into the 5 axes of diagnosis. Axis 1 typically has to do with clinical disorder. Anorexia is classified as an eating disorder and is therefore a clinical disorder that may require clinical attention. Axis 2 has to do with personality disorders and mental retardation, which Hannah does not exhibit. Axis 3 has to do with general medical conditions that underlie Axis 1, which Hannah does not exhibit. Axis 4 has to do with the psychosocial and environmental factors. Hannah's anorexia that has causes that can come from outside environmental factors such as reputation or athletics. And in this movie's case, Hannah's desire for thinness. Axis 5 has to do with the global assessment of functioning scale. Hannah is shown as having a low level of functioning due to her erratic behavior and low calorie intake, which is a form of self-harm. Because of this, I would give her a score of 40 on this, meaning she has serious symptoms and impaired function. Now, after completing the 5 axes of diagnosis, we believe that Hannah has anorexia nervosa. But what evidence points towards that? Well, anorexia nervosa is a type of eating disorder. The typical patient for anorexia is typically a young female. In fact, it is estimated that 85% of patients are female. However, it is important to remember that the other 15% still exist, and we should not assume that it is impossible for males to develop anorexia nervosa, which tragically happened with Hannah's brother in this case. But still, meeting the typical patient identification doesn't automatically instigate a diagnosis. You need evidence of behavior for that. In the movie, Hannah is constantly seen popping laxatives, not eating her food, having erratic behavior, hiding food to make others think that she is eating, and constantly obsessing about meeting her weight goal. The DSM-5 states that a person with anorexia has a fear of gaining weight or becoming fat, or persistent behavior that interferes with weight gain, as well as specific disturbances in relation to perception and experience of their own body weight and shape. Hannah meets all of these criteria due to the actions I just previously described. Now, let's talk about differential diagnoses. These are typically difficult to make in individuals with suspected of anorexia nervosa who deny a fear of weight gain. But there are still many differential diagnoses that Hannah could have, including avoidant intake disorder, which according to the DSM-5 precedes the onset of anorexia. Avoidant intake disorder differs from anorexia in that it has less to do with the drive for thinness, but rather may involve picky eating. The DSM-5 states that it is hard to determine which illness the patient has in many situations due to similar nature, however. But I believe in this case it is still anorexia rather than avoidant intake disorder. Finally, let's talk about different treatment plans for Hannah. We'll go over 3 different approaches, but first, let's define our objective, which is for Hannah to gain weight and lose her anorexic tendency to abstain from eating. One method for accomplishing this is through methods like group therapy. In this therapy, Hannah would be meeting with a trained therapist with other patients. This is poised to work because exposure to one's own problems and pain as they're experienced in the lives of the others facing the same problem can bring about the change of unforeseen kind with far-reaching consequences, according to Slabporg-Boguski. Hopefully, this will help stop her anorexic activities. Another method that could actually be coupled with the previous method is supervised weight gain in an inpatient facility. This with therapy sessions would, in my opinion, be the most helpful method for Hannah. This is because it is in a supervised environment that forces Hannah to eat, which will improve her health. In addition, the facility could use positive and negative reinforcement techniques in order to build and break Hannah's anorexic habits. Finally, one last approach to helping with Hannah's anorexia is the use of drugs in medical therapy, specifically SSRIs like Prozac. This drug is not capable of curing anorexia and increasing weight by itself, but it can help ease the mood swings that come with anorexia. I would recommend only prescribing this after 85% of their normal weight is in order to help with recovery. This means that other methods like therapy are still needed to cure Hannah's anorexia. Nevertheless, the SSRIs can help make therapy more easier and manageable by managing the mood. And that's it for today on Hollywood Mental Health. I'll see you next time.
Oh,